so then there we have the loving presence, would play a huge role. The loving setting, setting everything else up. So then what, this is also put in the book from somebody's visions that they told me during the group share, like, what is love? He had this long journey of ayahuasca explaining love to him, and it ultimately was the acceptance of all things as they are without reservation, which is kind of a universal concept if you look at other belief systems. And so you're trying to set up an environment of safety, where acceptance is going to be, you're trying to promote, right, and encourage acceptance. And the presence, your guys' presence, and the way you prepare the patient for that, because it's not, your ikaro, like, because, there's this, right? There's first direct engagement, there's me singing to this person, and then there's you sitting over there, and you can't really hear the ikaro, and you're just going through the experience. Maybe you hear it, maybe you don't. For you, it's the psychotherapy sessions before, leading up to that, is a huge part of this. During the event, then you are the presence, that's very much in a loving way, and then after as well. So I think there's the direct, you do have a direct experience through the therapy around it, and then during it, your relationship still holds. They know you from all this, and then there you are. So that is shamanic.
Plus
Yes.
you probably had your own experience with the same medicine outside of that setting previously.
But it's
It would be
more
helpful in the presence in that session.
Yeah, but most of all, it's about the relationship. Again, it's not that different. It's the relationship. It's like, yeah, okay, I'm seeing the video. You're talking to them. They're telling you, instead of trying to figure out, what's wrong, what happened in their childhood, and what did I see under their, liver. It's like they're telling you, oh my God, this happened to me. And so that relationship is a dynamic that's allowing things to start moving. Yeah.
There's the way I'm thinking about it right now, after talking and to your question, is so you take the active elements of the shaman and you take the ayahuasca away. What are the other elements that are there? Like what else are they using besides the ayahuasca to elicit healing? And so there's loving presence, right? There's concentration. There's intention. And so we can go down the list, right? I'm not going to go all the way through it, but I guess the way I'm thinking about it is that those things, even without some infusion on the therapist side, even just having all those things in place in a really strong way, right? Because the ayahuasca makes it stronger.
Could be very influential. Yeah, and so that's the nature. So part of the story of my book is like, yes, this is what we're learning from these people going down doing ayahuasca tourism, but the idea is like, what's the role of spiritual healing? In other words, beyond ayahuasca, what are the concepts that we're learning? And the idea is like, well, this would be what's behind prayer. So this intention and our ability as we develop it, more and more, it's like, singing ikaros to somebody late in the night. It's like, well, I'm not really high anymore. It's just from so much practice. And so they're maybe a little bit high, you don't know. Or so in other words, and they sing to people sometimes when you don't have ayahuasca, okay, we're just going to do what we do. And then these elaborate rituals, let's say Native Americans or somebody, my Navajo friends will set up and generate to create an environment that would promote this kind of stuff. Where all of a sudden people start sharing and opening up in a sweat lodge or wherever it is and having these huge cathartic releases. So ayahuasca and psychedelics are one way, and it's the reason they're kind of seemed like significant in this time is because our culture is so closed that's like it's hard to even start with somebody because they're so closed up, they don't really feel this, like, or they don't even want to talk about this. And so to go at them that way, it's like they're like, I don't feel anything, this guy's just shaking a rattle around me, who cares, so but the person who's open can receive from that, or they report receiving from that. The person who's close to psychotherapy is like, well, whatever. The person who's open, a lot can happen. So it's not just ayahuasca, but it lends itself to all forms of intentional, imaginal, whatever, psychedelic, psychiatric, psychological, psychosomatic, etc., etc. Anybody else? Yes? There we go.
Yeah, thanks, Joe. I do have a question, but I just want to, if it's all right, I think what you're doing is sort of reframing it. You sort of reframe some psychiatry stuff on the right-hand side, and you can look at it from multiple perspectives. So it's exactly what we've been saying in
Right.
the groups,
Yeah.
that provides better access to the truth by seeing the same stuff being talked about in different ways by different cultures, different words.
Yes.
But for me, my question is, how do you get in terms of the discourses that are around this? I mean, you're a medical doctor, right?
Right.
You work with psychiatrists.
Right.
Generally, the people prescribing antidepressants, if psychiatry is medicine for the soul, I mean, I just looked it up, that's the etymology of psychiatry.
Psyche is soul, like psychedelic is soul revealing, not mind revealing.
Yeah.
That's kind of a twisted little translation people have come up with.
And it seems to have gone, it's lost its way a bit.
It's lost its way a lot of it.
And, psyche is often a butterfly, and the coat of arms for the Royal College of Psychiatry in the UK has like snakes on it. It's pretty much the Soltara logo.
Yeah.
But it's lost its way. But to get to my point, the question is how to sort of shake people out of being locked in one perspective. This is the $1 million question for me.
Sure.
Is if they're like, how do you get them to drink?
Yeah. Well, so then this is how you do it. This is my idea. Okay. So this is like, we have this whole presentation. As I like to say when I'm talking and because I'll be talking in this group, and then the Navajo friends will say, "Oh, why don't you more spirit? How come we're doing all the science? I'm like, you know what? We're going to present it in a way. The goal of my presentation is to present it in a way that they can't just check out. Instead, say, "Oh, there, he crossed the line. I'm out." He talked about the energy body. No thanks. So how do I do it? How do I do it? So health is the number one way. Health. That's what they understand. So my book is based of cases. Okay, so I start with cases. So real cases of real people. Starting with myself getting depressed, and trying antidepressants and showing people like, hey, you know what? While I was doing that, I kind of realized that from hearing research around it that the psychedelics and the SSRIs are quite related biochemically. And that's why they're being used so widely in the same problems. Anxiety, depression, addiction, PTSD, whatever. It's like they use it, OCD. They use it because it's working on the same system of the brain, neuroscientifically. Like, that's a simple fact. So if they want to get to that, it's like that's one reason to consider it. And then, of course, there's all the clinical research around that. Once you raise that topic, then we say, well, here's the studies. So that's that. And then I start going down the line, and getting into the fun, entertaining stories. And I say, okay, then all of a sudden we have this person, PTSD. So we choose cases that the system is failing with, number one. So we're not threatening the system. We're not trying to bring on the wrath of the system. We're trying to be helpful to the system. So we, in fact, choose and focus in our arguments on cases that they don't know how to help, and that any honest doctor or any honest, they know that they failed with these people. So PTSD from Vietnam. In other words, he's had PTSD for 40 to 50 years. He's failed therapy for 40 to 50 years. So the Vietnam vet in the United States is one of the most obvious failures of the healthcare system. So we use that case. Look, here's somebody with PTSD. Guess what? And then in the book, I present, hey, here's what we know about PTSD. This is what the psychologists say about PTSD, blah, blah, blah. Here's treatments that people consider for PTSD. Here's what this guy did. He was on these psych meds, he was on those psych meds, he was on this therapy, he did group therapy, he tried that. It didn't help him. So after trying all that, he decided to try this. So then we go on, so then it's the lady with the chronic cough, the idiopathic cough, that she's been going to all the pulmonologists, and she had the CAT scans, and she had the breathing functioning tests and everything. So I'm talking their language, and at no point am I saying don't go to the doctor. I'm saying everybody that we present went to the doctor, and they went to the psychologist. So again, that's the way to strengthen the argument, is you never like go straight to, you don't get hokey pokey and just say, oh, forget this, just take them to the shaman. I mean, even maybe that's good, but you wouldn't tell them that. What is the sense of that? You want to be as sensible and take advantage of the knowledge base that we have, that they understand. But then, and then as we go down, then you get the chronic cough, then you got the lady with the chronic back pain and the knee pain that turns out to be because she had sexual abuse as a child, and she was about to she already had 2 knee surgeries. They want to do back surgery. They want to do antidepressants. She's not getting better. She's seeing 3 different specialists for her problem. And then you go on with psoriasis. This lady, when she got the psoriasis, skin flare, every time she's emotionally stressed, the flare is worse. She has a big healing, you know. Migraine headache. The doctor's not helping migraine headache. Okay? It's not an idea that you heal a migraine headache. So you show how somebody can heal, and not everybody, but this case. Look at this. And you relate it directly to all of these concepts. You show the evidence, epigenetics evidence in migraine, childhood trauma in migraine. And you show them maladaptive stress response in migraine. You show them all that to build the argument. Then you do it again with addiction. Then you do it again with anxiety. Then you do it again, you know, with whatever else I have in there. And so that's the way, is to show with real people and their health. So spiritual well-being manifests in emotional health, so we focus on emotional health because that's something they're willing to accept. We don't need to go over here yet. We can just show them what's wrong here. That's enough. Because when it's their loved one and it's their child, they're going to forget the paradigm. They're going to say, screw the paradigm. You know, that happens every single time. So they're, you know, once it's their kid, you know, that's the Last Shaman movie, which not everybody likes, but the guy's the son of some Harvard psychiatrist, or he's connected to Sloan Kettering psychiatry. You know, he's bringing them to the greatest experts in the United States of America. And he's a very intelligent man, and now his son is there, so he can drop the bullshit. He can drop the fancy lad poppycock, you know, and he can say, you know what? I just realized these guys don't know what it is. I've asked all of them, and with my deepest heart, because this is my child, and they don't know what it is. And so we can go ahead and relax the arrogance about, you know, our understanding of this illness. Because now we're talking about a real human being and their health. So we focus on real human beings and their health. And then emotional health is the bridge to make the argument. So that's why we focus on emotional biology, which is rooted in all this mammal biology and fear biology and rat anger and, you know, whatever mother-child bonding and all this limbic system stuff that's been spelled out and all the psychoneuroimmunology that's been spelled out and articulated. And so we can show them that way. So we're simply making the argument that if you see somebody who's showing disease, health problem, which involves multiple elements of the emotional body, the psychoneuroendocrinology network, and they have been through the battery of Western analysis, and they can't figure out what's wrong, you know, then you may at the very least consider that there may be an emotional root to this problem and start investigating that. And as you try to determine how are we going to deal with this emotional problem, you may consider a spiritual context. Why? Because they're shown to be effective. Case in point, psychedelic psychotherapy. I was scared I was bracing myself for the Englishman's question. But it was, thank you. See, that's my approach. Yeah. Okay.
Thank you.
Anybody else? Anybody else?
Oh, I have a question.
Yeah.
So, like, we know from the research that when people experience traumas, if they're interpersonal traumas, they're much more likely to result in PTSD and the symptoms are worse. And I'm wondering if you think that interpersonal aspect is connected to this spiritual piece in your model.
That would be more damaging.
Right, like a rape versus a car accident, you know?
Yes. Yeah.
Yeah.
So that would be, you know, because there's these two people, and so there's two human beings is the potential for a lot of energetic interaction, you know, and a violation of the person is massive, you know. Killing someone, you know, sometimes aborting a child, you know, can bring on a lot of this kind of trouble, you know, not that it's good or bad or whatever, but just from a health perspective, that it's energetically maybe something that needs to be addressed because of that, the nature of that. So the power, as Bia has been talking about, the reality of relationship, how influential it is in our lives. That how, you know, all these people in this end of life research and all that, when you die, you know, most people are thinking about their relationships that they had in their life. And when your heart opens up in ayahuasca and you're trying to figure out what's wrong with you, quite often the first thing you start going to is realizing, I need to repair these relationships. This is why my health is wrong. It's because of the way I'm relating to these people. That's why I'm sick. And if I can fix that, my immune system's going to start working better. Because I'm made for that. I'm made for healthy relationships. And so when I come out of healthy relationship, my body is like dealing with GMO, existence. It's not, it doesn't match. Anybody else? Anybody else? I've been training for this for years, guys. This is it for me. All right. Well, thank you. Oh, here we go. All right. Maybe there's a little. Okay.
It's not even a question. It's like a joke I got from reading the book with the epigenetics part of it. I was like, basically, my reframe of what you were saying with that is that part of what ayahuasca is doing is epigenetic cleansing, not to be mistaken for genetic cleansing.
That's correct. Yes. Which is, a delicate topic. Yeah. Yeah, epigenetic cleansing. That's what I made that argument that when we're trying to show like the role of spiritual healing, the role of intentional healing, the role of these things, and show why it's important. And so we believe health's important. We believe biology is there. We can measure it. And so when people shift and heal, like with PTSD, you can show like certain genes are affected, like certain cortisol genes and BDNF genes. When somebody has bad PTSD, it's not uncommon to see this like epigenetic alterations there. And when they go through healing, even if it's with psychology or psychotherapy, you can see those things repair, without any kind of direct material interaction. Just this loving presence and this psychological work, and all of a sudden something's changing at like one of the most profound epigenetic biochemical levels in our body. And so that really, so I say like, I just get this is a self-published book, so I just get to say whatever I want. So I said, because I was just like, because that's a problem in academic. There's, you want to be very careful and pause, and you have to defend every step. But when you go self-published, you can just say it. And I said, spiritual healing meets biochemistry at the epigenetic level as like a hypothesis. I'm going to say that. Now let's see if it's true, and that's what we're doing. And so that the book's inspired the research project. Yes.
I work a lot with people who have both PTSD and diabetes.
Yeah.
And so I'm just thinking that, you could maybe create something that would work with all the spiritual and emotional parts of you that would also help with the diabetes, because then you have the immune system and neuroendocrinology.
Yeah.
And all of that, because they're very connected.
Yeah.
And I can imagine that working with not just trauma, but they have the combination. The diabetes seems to be connected with this.
It's more common, yeah. And so it's on that holistic level, because we could say this emotional trauma, right, is throwing them off. One simple thing, okay, their cortisol levels are high all the time, their blood sugar's up, they're stressed out, they're overeating, you know what I mean?
Yeah.
Their blood pressure, it's basically a proven fact from psychoneuroimmunology that blood pressure is a very psychosomatic thing, like salt and all that, but the psychosomatic element of blood pressure is extremely real. And so then that's where you get the heart disease and the blood pressure, and then the eating, the lifestyle.
But even working with the emotional part of it could even help with the diabetes.
It does.
Yeah.
So Russ, the PTSD guy, had diabetes and heart disease, and then as he went through, he lost a lot of weight on the diet, but then he just had a whole downgrade, this chronic inflammatory response in his body.
Yes.
And all of a sudden it was easier to manage day-to-day life. The physiology response.
Joe, I just want to say this should be a required lecture at the CPTR program. I really feel like I got more from this hour than most of.
Are we already at the 1 hour mark?
Yeah, this is great.
Yeah, thank you. Well, that's my thing. Get them to make the book, textbook. Because that's what that's it. I don't know if that's the thing. I don't know. I had to fight with the editor how much science I want to put in it. But the point of the book is to present these ideas, and then you can expound on the ideas. And it's set up like each case is like, here we go, and it has here's all the like related research literature to prove it, or at least to make the point. and it just opens it all the way to that, and then it's, so that's like the fellowship of the river. That's the point, you know, is that was my medical training within the Amazon. They, you know, thanks to my medical training and my psychoneuroimmunology research job, but it was in the Amazon that I learned these things, and it was the ayahuasca that told me these things, and it was the people that we treated that told me these things, you know, and so that's, and it was like in my visions last night to draw this like that, you know, and so it's like my thing is like, hey, it's there, you know, we can open ourselves to this, and some of it's, you know, maybe doesn't help us, but some of it is like useful. So, any more? Is that it? I go too very, sorry, Via. Thank you, Via, for letting me go off.
Thank you.